Today I wanted to share with you some snippets of a conversation that I had with Madhavi Gavini, who is one of the founders of the Droplette. Now, if you're not familiar with the Droplette, briefly here, this is a misting device that essentially takes capsules that are filled with serums and it propels those serums through the device and into your skin. So the entire concept is that it can take things that are generally a molecular size that's too big that will sit on top of your skin, and it helps to push them into your skin, making them more effective. They have developed an app that gives you the ability to take your droplet, if you've had it for a long time, and put it into a turbo mode, or put it into a growth factor mode, or put it into the lip plumper mode. And then also they've updated the device so that it is already set up with the turbo. We get into a bunch of that stuff that I think is the most exciting things that are going on with the Droplet, especially the growth factors. And hopefully it will help answer some questions and just enlighten you a little bit if you've been curious. Now there is going to be a longer version of this video available via a private link. Leave any questions that you have down below in the comment section. They will be happy to answer anything that you pose, and I'll answer anything that I can as well. I will see you on the other side. I have questions that I have actually written down, so forgive me again. I don't want to miss anything. I've been preparing like crazy for this because I have so many questions that I know other people have as well. So the first question that I do have for you is about growth factors. And I want you to share with us what went into bringing the growth factors to market. If you could just give us the rundown on that, we would love to hear the behind the scenes details.
Yeah, I'm excited too. So growth factors are a really, really cool skincare ingredient. And I'd worked with them before a Droplet. So growth factors, just for people who don't know, right, they're hormones or proteins that basically act as the instructions for cells. So they will tell cells to do things. They'll tell stem cells to differentiate. They'll basically tell senescent cells or cells that are old or aged to kind of, they'll help remove them. And they play a huge role in aging. And they're just this incredible class of potential therapeutics for things like, spinal cord injury, Parkinson's, Alzheimer's, and have been kind of touted in the academic literature for quite some time as this amazing, like, regenerative anti-aging class of proteins. So when we were thinking about what product we'd want to put out next, it just made a lot of sense for us, both because we had worked with them personally and had kind of seen the impact that they have on cells and tissues ex vivo or in medical settings, and and just the fact that they're very, very cool. So when we had worked with them, like when I'd worked with them in a laboratory setting, we treated the stuff like it was liquid gold. It was $17 per milliliter to get the really high quality stuff. So 1 liter of that, if you're a grad student, that's basically your annual salary. And you wait for it to come in, you aliquot it. So you basically distribute it into very tiny volumes and you put it in the -20 or the -80 for storage. And so we had always treated it like this really delicate ingredient. And that's because these proteins are just not stable for long periods of time. So we knew that when we were going to launch a growth factors product, we would need to figure out these cold storage logistics. And we wanted to get really high quality growth factors. And that's so important, as you know, because when growth factors are in the right concentration and are high quality, they're incredible for anti-aging. But if you get growth factors from sick cells, dead cells, or they're just kind of in the right ratio, or you get inflammatory ones, they'll actually age you faster. So we get our growth factors from this really amazing biotechnology company out in Texas called Hope Biosciences. Their conditioned media, so it's stem cell conditioned media, which is where we get our growth factors from, is currently, their products are in a bunch of clinical trials. Like they're doing work on crush injury, burns. They're an official partner with the US military. Like they're legit. And it helps that their CEO is also a Hopkins alum. So we buy our conditioned media from them. It's shipped cold to our formulator, and then it's shipped to us also on ice. And then we fill, seal, put in capsules, and we freeze it. And when we ship it to customers, we ship it with ice packs, and it's 2-day shipping so that the temperature fluctuations aren't too great, like they don't get too hot in there. And we ask that when you receive it, you use it, you put it in your fridge if you're going to use it right away, or you put it in your freezer if you're going to store it for longer. And that's really to preserve the integrity of these molecules. And we've done third-party assays. So they're called enzyme-linked immunosorbent assays, ELISAs. And we do that to basically guarantee that when our growth factors go through this entire process, they're still going to be stable. They're still going to be present in high enough concentrations, and they're going to be biologically active. And so that's kind of what we can guarantee with this process.
Basically, what you're saying is if these growth factors were in a store and placed on a shelf, just they were on a shelf, yours, and they were there for a month and I came in and bought them, they would not be good, correct?
No, they wouldn't. I mean, it's a protein. So, okay, so I'll give you an example. There's one FDA approved drug that contains growth factors. It's called Regranex, and people can look it up. And it contains a synthetic version or recombinant version of a platelet-derived growth factor. And so this is a really stable version of this growth factor that's synthetically made. So it doesn't matter if it's synthetic or not. And it's in like a lyophilized powder in a thick like emollient solution, which is just about as stable as you can get it. The whole process is FDA approved, and that drug is still stored in the fridge. So, right. And then even if you go to Sigma Aldrich's website, so they make epidermal growth factor, they'll tell you straight on their website, this is good in the fridge for a month, and it's good in the freezer for up to 6 to 12 months.
Bottom line is growth factors are incredibly unstable, it sounds like. Yep. And that at room temperature, they are not good for very long.
That's correct. They're good for maybe a couple weeks.
Okay. Interesting. That is really, really interesting. Okay. So can you tell me if the growth factors that you source, are they vegan? Do we know the source of the growth factor? I mean, are they human derived? I know that a lot of people will ask questions about, aborted babies and stuff like that. They just want clarity on that kind of stuff, that it's just definitive, no, this doesn't come from anything like that kind of thing. If you could just address that.
Yeah, of course. So our growth factors come from, they're basically conditioned media is what we use, which is the exudate of stem cells. And we get our stem cells from healthy adult donors. So they're compensated. It's all ethical. This is not a HeLa situation. And they are screened. So these are donors where you screen them for, any illnesses. And then independently from the vendor, Droplette does its own set of assays on the conditioned media. So we guarantee that it has, the growth factors you want. It has like EGF, it has transforming growth factor, it has pro-collagen, it has all of that good stuff in there. And we've quantified it. And I think that's actually the first time, like I haven't seen anything else like that on the market where that's been fully quantified and characterized. And I think that's sort of our pharma backgrounds coming into play here.
And as far as being vegan, none of your things are tested on animals, correct?
No, our formulations are not tested on animals.
Okay, cool. Well, let's talk about, we can't move on from growth factors, certainly without talking about the price. And I think that I do think that it was a shocker for a lot of people. And I think that part of that, and I mean, I'm just going to put my kind of 2 cents or my take on it, is that they're really used to, the growth factors that are on the market that maybe are between $100 and $200 or that kind of thing. So even though we just went through everything that you just went through, if you could just give people a little bit of a breakdown when we're talking about price as to why it is that expensive.
Yeah. And it's a good question and a completely valid one. So the raw material, the conditioned media is really expensive. I mentioned before, if you're buying it in small batches, it's about $17 per milliliter. And then you have to pay to get it shipped cold or frozen to the formulator. They have to store it frozen. So there's a clear upcharge on that. They ship it to us frozen, once again, an upcharge. And then when we ship it to you frozen, if you've ever received frozen food in the mail, like what those delivery charges look like.
Right.
So that's a big part of it. It was really making sure, paying the premium on the ingredient because we believe the quality ingredient is worth it. And then also making sure that we've created that infrastructure around cold storage logistics to make sure it was available and bioactive when it got to you.
Something I do want to ask you also, though, something that I said to people when it first launched was that if you don't want to use it twice a day, obviously I understand that that's a lot of money.
Right,
It's
right.
a great augment to in-office laser procedures. I know that Nancy and I, when we did our Elicor treatments, the difference between our healing time with and without droplet growth factors was like no comparison. I mean, it was absolutely incredible. I also think it's fantastic, used when microneedling or anything like that. So do you agree that a way to kind of offset the fact that it's so expensive is to use it as a treatment? Would you consider, or have you, given the feedback, would you consider selling them in like half packs in the future?
I think we definitely consider it. I think the reason we didn't want to do it out the gate comes down to efficacy. Like it just takes a while to see growth factors have an impact. So our concern was, okay, if we do 14 and then people use it and it's just not long enough to see a result, we don't want people to be disappointed.
Right. Which is funny because even though you would be spending less money, you really aren't getting your money's worth because you're not getting the efficacy, because you're not getting fully treated. So that makes complete sense to me too. I do think though, it's something to consider, because I think that people could use it around a monthly microneedling treatment, and one maybe in that situation, maybe that might be enough capsules. So I'm just putting that bug in your bonnet. Okay, so what is the feedback that you've gotten so far about the growth factors?
We've had people who this is all anecdotal, of course, like we do our own studies and, we can sort of quantify those results and say, you see this improvement in this or this parameter. But anecdotally, we've had people who've said, I've had this scar since I was a child, or this like mark on my face since I was a child, and I've used your product for 4 weeks and it's gone, which has been incredibly just heartwarming to hear. Similarly, we've heard feedback about scars and just sort of people seeing this big improvement in their under eyes and like those sort of fine lines around there, which is not something you can really treat with an in-office procedure.
Right.
It's really delicate skin. You don't really want to inject if you don't have to under there. And people are seeing that impact with growth factors.
Tell us about the connected device, how the app works with existing devices. What if this person said, what if mine is a year or more old? And what is the real benefit with the turbo, et cetera? And when will the Android app be coming out? And I just throw all of those at you at once.
Okay, so for the app, it's compatible with every version of Droplette that we've put out there. And a big part of our philosophy is when we innovate on things or we come out with new products, we don't want to leave anyone behind. And the last people we'd want to leave behind were our early supporters. So it's fully backwards compatible. So the app does a few things. You can talk to an esthetician, one of our in-house estheticians, totally free, and they'll give you great skincare advice. You can, track your own usage, and we're continuing to update and add features to it. And probably the most exciting thing is you can actually personalize a device to you. So we have different modes, and these initially kind of came out of this discussion we had around people are buying our capsules. They're spending a lot of money on capsules, and we want to give you more than one use for them. So you can do, with collagen, you can do your whole face and you can do a great treatment with that. Or you can really target your under eyes and get like that really specific, hyper targeted and quick efficacy product as well. Same thing for acne. We have a blemish mode coming out pretty soon, which lets you do a targeted treatment to like a blackhead or whitehead or cystic pimple. And some of the before and afters we've done in our trials have been pretty incredible, with like just 24 hours later with it resolving. And we have like a special mode for growth factors, because growth factors are large molecules, so to improve that penetration profile as well. And probably our newest one, which people seem to really like so far, is what we call 17-volt lips. It's basically a 1-minute lip plumping treatment at home.
You say that you can get a 40%, more volume when you use the lip. Can you kind of elaborate on how you get that data and just the lip formulation in general?
Yeah, so the lip formulation it's kind of a cool story. So we got the idea for it because we had one of our newest team members on the marketing side, just joined. This was a few months ago, and I took her out to lunch and I was like, tell me about what you want to do in your job. And one question I always ask people is like, what is a product that we don't have that we should have? And she said, lip plumping. And I said, really? Like, do people still do that? And she said, yes, like, and kind of gave me this look like I was crazy. So we started looking it up, and she was exactly right. Lip plumping is something that people really genuinely care about. And I think it's so funny because it wasn't on my radar, probably because I'm Indian and it's not a huge thing in the Indian community. But it's definitely a thing. So we knew that we could do lip plumping years ago, but we just kind of put it off to the side because we didn't think anyone would be interested in it. And this kind of reinvigorated us to go ahead and pursue that. So the way we quantify lip plumping is we use this software called ImageJ. We take photos of people. So we have like our standardized photo thing. We use Avizia in certain offices, and we have like there's another brand that does something very similar. So we take all those photos and we run them through ImageJ, and then we measure like the lip height. So we do like, like bottom to top, and then like basically these like vertical heights, and we compare them, and it does pixel to pixel, and we can quantify those results. So that's where we're getting the 40% from. That was kind of the average we saw in our studies and our user groups and early sort of mini clinicals.
So funny thing about this is that I think that the lip plumping thing is definitely still a thing. That's for sure. But I also think for women, as we get older and our lips start to deflate a little bit, it's not necessarily that we're looking to have like, huge lips or anything like that. It's just a little bit more youthful for our lips to plump back up, as in not big, just as in hydrated and juicy and looking like they did when they were younger. And so to me, this lip plumper it can reach the age of people who are into lip plumping. And then it also will be really, really great for those of us who are noticing that our lips are deflating as we get older. So to me, it's a really cool product that, I think that's neat. That is a really funny story. It's funny too, the things that we don't realize are a thing, as we go along. And then you realize that really is actually a really big thing. I think it's actually a bigger thing than you even realize it is, because it's going to appeal to a whole market of people who are a lot older than you that you don't even know until you get there, something that you want. Can you tell me, since it sounds like the new device, the updated, the most current device is very solid, can you tell me what you would say to someone who went through a few devices? Let's say they went through 3 devices. Right. What would you, and they're like, forget it, at this point, let's say, what would you say to them that is, this device is solid and, give it another go? What is the data that shows, what can you do to assure them that it is now good to go?
It's a good question. So we track all of our failure rates, and we know why things fail. I think this is probably a question that's going to come up later, but we have asked a lot of our customers when they've had issues to send us videos, because once again, very technical team, and the way our minds work is if we see a problem, like we immediately want to jump on it and solve it. And we've removed that policy because we've realized in hindsight, and it's really embarrassing, that people felt like we were questioning them, that we were questioning whether they actually had a device issue. And that was not at all the intention. It was literally just us being overzealous and wanting to immediately understand and fix a problem. But we know why things have failed historically. So like that, so information is power, right? So we can avoid making those mistakes going forward. We've created like a really stable process to evaluate all the componentry that comes in. So mishaps we had earlier won't happen again. And I'd say most importantly, we track like how our devices are performing, and we've seen like these new devices are just incredibly stable. We've actually been stealth releasing them for quite some time. So I know we had like a launch for Connected Droplet. Realistically, like a pretty large cohort of customers, even a month or 2 prior to that, did receive those units, but they weren't advertised as such. And so we've been tracking that for a while before we really came out with this new device, and we felt confident sort of making those claims, and of course extending the warranty to 2 years.
Okay. Okay, next question is, I bought my Droplette at the end of 2021. The machine product did not work for me. I would like to know if they could offer the option to replace the product or suggest something we can do to use the machine. Right now, this is sitting in my closet. I would have loved for this to work for me.
Yeah, if you bought Droplette and it didn't work for you for whatever reason, please reach out to our customer care team. We have new products now, so perhaps one of our new formulations will be a better fit. And if you had an issue with your device, we will replace it.
Perfect. I think that that's the overarching theme that, we're going to hear again and again, is that if there was an issue, no matter what, dating all the way back to the beginning of Droplette, that it sounds like you are willing to make it right.
Yes, and we're eager to do so.
Yeah. Thank you so much for taking the time to answer some of the questions. And as always, this was just an enlightening, wonderful conversation. And I just appreciate you being here.
Thank you so much for having me. This was great, and hope to have many more of these conversations in the future.
Okay, you guys, I hope that you enjoyed this conversation with Madhavi. Again, I'm going to leave a link to my private Facebook group. If you join the group, you will see in the pinned featured that I'm going to leave another link to an even longer version of the video you just watched. Again, we probably were on Zoom for, 2.5 hours. So I had to really condense it down to make it kind of digestible for people. So if you want to see a little bit more, there are more questions that are going to be on that video. In fact, I'll give you a couple examples in the description box of some of the other questions that will be on the full length video that will be linked in my private Facebook group. So anybody with that link will be able to view that video. Okay, you guys, I hope you have a really wonderful day, and I will talk to you in my next skincare video. Take care.